but please feel free to introduce yourself in the chat. Okay, and we're 12:30, so we're going to start. We have a packed agenda for the next hour. So hello and welcome to day 5 of NQI Lunch and Learns as part of Clinical Audit Awareness Week 24. My name's Vicky Patel, Chair of NQI Clinical Effectiveness Manager at the Rotherham NHS Foundation Trust, chairing today alongside Marina, our NQI General Secretary. I'm sure she'll give you a wave on the screen. The theme today is all about sustainability, that's sustainable change. How can we utilise clinical effectiveness to sustain change that shapes health and care for the future? So this event will be recorded. It would be lovely to see your cameras on. The chat function's live. We ask you to remain muted if possible to allow less noise for our speakers and the recording. So if we move on to the next slide, you can see our table of lunch and learns across the whole week, and we're now on day 5. So the slide packs and recordings alongside further resources will be published on the HQIP web pages and the NQI Futures workspace as well. Yesterday we moved our focus onto change, and today we're going to take this one step further by asking you to start to think about how we can make changes that do sustain over time but also adapt to the health needs of our communities. And Zoe Lord, Deputy Director of NHS Horizons, has joined us today and will be inspiring us all. So if we move on to the next slide, we'll briefly look at the next hour's agenda. So we're just going to set the scene a little bit to begin with and touch on previous years and highlight some key points that we want you to consider for today. We'll hand over to Zoe then, who will then also announce the winner of our Sustainability Clinical Audit Hero Award, and they'll present for you as well. There'll be the opportunity to ask questions. Please do pop them in the chat as well. We'll respond to things in the chat as we go through. And if we haven't got time to cover all questions, we're going to collate those and publish them in a Q&A document alongside our slide pack and recordings, as we always do. And right at the end, because we always love to hear from you, we'll be just running a really short evaluation. If you can click on the link when Marina supplies it to us towards the end of the event, we'd love to hear from you. Please do feedback, because we do use this to shape our future events that we hold for you. So if we move on to that next slide, then we can see that this week, as we've said already, as we've gone through week, then it provides that platform for us to showcase everything that we're doing every day in the wonderful world of clinical audit and that impact that it does have on improving health and care. So we've touched on this every day this week, highlighted that NQI-CAN's got 10 regional networks. We're going to pop some links into the chat for you so that if you're not yet a member, you can get in contact and join your local network that feeds into our national network. NQI-CAN hold quarterly open meetings, free to access links shared on our web pages, and the next meetings 24th of September, 10 AM to 12 PM. So obviously we'd love to see you join us. We do have a network and sharing forum, and on Monday we were very excited to announce that we've actually moved that platform, the forum itself, across to the Future NHS platform. So anybody that was a member of our forum previously will have been sent an invite for you to join that workspace. If you weren't a previous member, we're going to pop the links in the chat for you so that you can then click on them, takes you across to Futures, and you can ask to join that workspace. So that's where we'll be networking with each other around local clinical audit. And the second workspace we've got on the Future platform is the National Clinical Audit Learning and Knowledge Hub. So a focus really on that workspace around taking action on national clinical audit findings, and we'll pop that link into the chat for you as well. So on the next slide, we've just recapped on what we challenged you with last year. when we touched on sustainability, and we asked you to go back and have a good look at your strategies, your policies for clinical audit, and have a look to see if they align with addressing that equity and access and sustainability within your organisation, and then to have a little bit more of a closer look at your clinical audit programmes and what the topics were with the audits that you were including, and actually were you measuring things such as your new technologies and new ways of working. And then when you got your findings and your action plans from your clinical audits, were you taking those forward with that focus on innovation, new care models, and looking at that access and equity? So we'd love to know how you've got on. So please do get posting in the chat. Maybe you didn't manage to take that forward. Maybe you met some challenges. You might have overcome those challenges and you want to share, or maybe you want some advice from your peers. So if you can post in the chat, that would be fantastic. So if we move on, I'm just going to set the scene for getting your thoughts in that right space, really, for us to then hand over to Zoe and hear what she's got to share with us today. But also it's an opportunity now for me to almost set you a few challenges to take away. As we move to the end of this session, we'll be pretty much summing up the week, so I'd quite like to focus on it at this point, if that's okay. But we've had a number of national publications over the last year, and of course in Clinical Audit Awareness Week last year we saw the whole launch of NHS Impact as part of Clinical Audit Awareness Week. And I don't want to say too much, as Zoe's obviously going to touch on things in a bit more detail in her section, but obviously clinical audit measures care against evidence-based standards, and we want to get your minds into that right space now to start thinking about clinical audit and sustainability, so that then when you hear what Zoe's going to share with us, you can start to consider how you're going to take this away and continue those conversations back with your own teams, organisations and systems. So this week in Clinical Audit Awareness Week, we're challenging you really to think about building that shared commitment for all of your projects that are coming through, that shared purpose with your stakeholders. If you think about our clinical audit effectiveness teams and our clinical teams, our frontline teams, we're very much conveners and enablers. We do influence and we do persuade. We've now got to start thinking about taking that step further and building on our collaborations with our system partners, so that working together, both internally and externally. We've touched on it in each Lunch and Learn this week, our clinical audit and QI teams, some have now merged, some are still working separately, but we've got a lot of improvement expertise between us, and we need to be working together to make things better, not just internally, but also with our partner organisations within our systems and pathways. And then just thinking a little bit more widely again around those technologies, that innovation, and how in terms of sustainability now, we pick up those clinical audit results and we're actually then using those to help us to shape health and care and take it forward. But also, are we measuring the right things on the clinical audit programme where we have actually adopted those technologies and new innovations? And then using our clinical audits to help to reshape our health and care for the future based on our population, in terms of their health needs and their health population data, but also in terms of demand and capacity. So hopefully you can start to put the focus of sustainability with your clinical audits in the right space in your mind then for us now to receive the information that Zoe's going to share with us. So I'm going to hand over at this point. If we move to the next slide, and then I think Zoe, you're going to take over sharing the screen, so over to you.
Thank you, Vicky. Can you see the slides okay?
We can.
Brilliant. So hello everybody. Thank you for this invite to your Lunch and Learn session in this very special week as Clinical Audit Awareness Week. I'm delighted to be with you today. My name is Zoe Lord. I'm Deputy Director of NHS Horizons. We're a small team within the NHS and we focus on large-scale change and transformation across health and care. So when I got asked to present and share with you some things on sustaining change, I was absolutely delighted because this is one of my favourite topics. And also the work that you're doing in clinical audit is so important to future-proof health and care and make it fit for the future. So the work that you are doing is so, so important. Creating change is so important. It's important for health and care services. It's important for our patients, our staff, everybody that uses services. This is really important. And it's important to us too. If we're creating change, and let's face it, change is really hard. It's really hard where we are now. When I started doing change programs probably about 20 years ago, it wasn't this hard, and it is hard. So when we see change not sustained, I can tell you from my point of view, sometimes I've been absolutely devastated. So it's really important to us that we sustain the changes that we're doing and do it for the impact that it has on patients and staff as well. So when Vicky kindly asked me to present on this, I thought back to what could I share with you today? And I took a bit of reflection time, and I thought about what's worked well when I've sustained changes, and I do what hasn't really worked well when I've tried to sustain changes as well. And it's from those elements of failure that actually I've got the biggest bits of learning. Failure happens, things happen. Let's accept those, let's learn from those. And some of these things that I've got to share with you is all about my learning from that. And what comes from that is it's all about people. People are the key to us and the work sustaining or not. So you'll see a lot of the content over the next 15 minutes will be about people, our interactions with people. So whether this is thinking about who have I included, who have I not included, how did I behave, how did they behave, did I help them too much, did I help them too little, did they feel valued? So we're going to have a little play with some of those things over the next 15 minutes. So before we get going, I want us just to think about 3 questions. What do we mean by sustaining change? When should we start thinking about sustaining change? And when does it finish? So I've been speaking to a few people over the last few weeks saying, oh, I'm going to be speaking on this Clinical Audit Awareness Week about sustaining change. What do you think? And some of the things came back and I thought, oh, that's good. Oh, how's this sitting? And what quite a lot of people came to me back and said sustaining change means like we've got to keep it firm. We've done amazing work and we've got to keep it exactly how it is. Yes, and to a point. But actually sustaining change is like the world is evolving, things are changing. So although we want to sustain our change, we want it to evolve as well. So we don't want it to be, you know, oh, it's a thing that we did ages ago. Actually, we've done this amazing thing, we've sustained it. And as the world's changed, it's evolved and we've built upon it. So that's what we're going to be talking about when we talk about sustaining change, keeping the great stuff and helping it to grow as the world changes. When should we start thinking about change and sustaining change? Well, many of us, even myself at times, start thinking about sustaining change at the end. We need to be starting about sustaining change, spreading change right from the beginning and building this sustainability in from the beginning. And I've got a few tips about how we can do that shortly. And when does it finish? Well, you might get an idea from the amount of question marks and exclamations at the end of that. It doesn't finish. We're in a continuous improvement cycle. And as I said about sustaining change, we need to continue thinking about how this evolves because we can't go back, because we need to make sure that our services are fit for the future. So, as I said before, everything on my learning is about people. As I'm going through these slides, have in your mind a project that you're working on, a program that you're working on. You might be at the beginning, you might be at the end, or it might be something that a project that you want to reflect on that you've done before. Keep that in your mind as we're going through. And if you've got any top tips about sustaining change, please add these to the chat as well. So let's think about who makes change happen. So this piece of work talks about who makes change happen. So there's people in formal parts of our system who make change happen. I've got a list here, and you can connect these to the people who are in your groups as well. So we've got people like delivery boards, program sponsors, clinical leads, directors of participating organisations, work stream leads, these boards. So these are people who make change happen, who are in formal positions of power. These people can help you with your programme and help you sustain it. We also have list B people who are also fantastic. These people are the mavericks, the rebels, the positive deviants who do things a little bit differently and they succeed. The nonconformists who see things through glasses that no one else has. Those hyper-connected people who seem to be able to spread behaviours, role model at scale. And as I put here, they set mountains on fire, and everything they put their hands on, they seem to multiply. The hyper-trusted people, so whether they're trusted for the right reasons or the wrong reasons, these people can make change happen. Now, when I started my work as a change facilitator, I would always focus on those list A people. And I wouldn't generally include these list B people. And more as I bring in these list B people, I find energy, I find things just move quicker, faster in different directions, and they are sustainable. And the great thing here is, well, list A people, they are generally paid to make the work happen. List B people, they're not paid to make this project that you're working on happen, but they can make it happen, and they can also break it as well. So having these people on board from the beginning can help you make sure that your work is sustainable. And again, as Vicky said at the beginning, we need to be thinking about our work, not working in silos, but also spreading out into different departments, different areas across the system to spread our work, but also make sure that it's sustainable. By having those networks, we can think about what's happening in different areas, what are the politics in different areas, and work with our project to make sure that it is fit for purpose and therefore sustainable. Now, this is a beautiful piece of work. If you haven't seen it already, have a little look up for it. It's called The Secrets of Great Change Agents. So Julie and Tiziana did a great piece of work. One's American, one's American and a Canadian, and they did a piece of work focusing on the NHS, and they looked at change programs, and what they found was, as a change agent, somebody who does change like you and I, my centrality in the informal network is more important than my formal position in the hierarchy. So where you are in this informal network, if you're in the centre there, you've got more power than the informal hierarchy. There's loads and loads of research around this. Here's another one from IC Collective, and they say just 3% of people in an organisation typically drive conversations with 90% of other people within the organisation. Are you that person? Can you be that person? Can you connect with those people to think about how you are receiving information and how are you giving information and how are you sharing what's happening within your area? So have a little think. Are you that 3%? Can you be that 3%? Can you connect with that 3%? This is my last bit of evidence on this, but there is loads and loads. Virginia Mason Institute and the NHS have been doing a partnership, and over the last 5 years, they've been undertaking an improvement programme about organisational wide improvement. And Nicola Burgess at Warwick Business School has been doing and looking at the evaluation of this. And what she found is they all got the same support and resources. However, they all got significantly different outcomes. So what was the difference? The difference was the level of those social interactions between those leading the local improvements. So this is saying, going back to that previous slide, is build your connections because you can get quicker, faster, and more sustainable results if you are connected. So when we've got these people, what are we going to do and how are we going to do it? Okay, many of you will know this model, the trans-theoretical model, sometimes called stages of change model. It was developed in smoking cessation, but actually it's all to do with behaviour change, and it can be done with any sort of change that you're doing. And I always come back to this model when thinking about change. If you haven't seen it or heard it before, I'm going to give you a quick whiz round. So it starts with pre-contemplation. So this person has got no recognition for the need, or they've got no interest in the change. 2, contemplation. This is about this person starting to think about the change. We move around to preparation. This person is now planning for the change. Not quite there with the change yet, but they're planning for it. Number 4, now we're moving into the action phase. And number 5, this is your element of sustainability, which is maintenance. So they continue with this new practice. People can move forward and backwards, but only one at a time. And everybody has to start at 1 and go all the way round. And in health and care, we generally, and all of the messages are all aimed at number 4, action, action, action. Now, if we have this action focus with everybody, and some people are at pre-contemplation or contemplation, your messages will either land on deaf ears, or they will do it, what you're asking, and it might stay for a week or a month, but it's not sustainable, and they'll whiz back to pre-contemplation. So have a little think about the pieces of work that you're doing, the individuals that you're working with. Where are they on this? I'll usually have a big sheet and I'll put people on and think, actually, how is my messaging connecting to all of these people? And how do I need to change my messaging for everybody to make sure I can move them all the way around to number 5, where we get our sustainability? This one was a game changer for me when thinking about sustainability. This is a wonderful model by Cormac Russell, and he says that there's 4 stages of change. He calls it 2, 4, with and by. So 2 is when we do change. Change is done to us without us. 4 is when change is done for us without us. With is when change is done for us with us. And by is when change is done by us for us. Now, when I used to go into these situations where we need to do change, I'd go into a clinical area, everybody'd be busy, not got any time for this. And I'm sort of like a caring, nurturing, motherly type of person. And I'd go, I'll do this for you. Don't you worry. I'm going to do this for you and you'll see the change. Actually, I didn't have sustainable change, because although I was taking it from a good place and a kind-hearted place, what I was really doing was taking everything away from the people involved in the change. And when you do the with and the by, you will get so much more people wanting to be involved in it. They do it themselves, and it's far more sustainable. So have a little think about how you're going about change, because I used to do 2 and 4, and that's because I was probably a bit too kind and everybody was busy. But actually, if I'd stepped back and did a little bit more with and by, that would have made the programs a little bit more sustainable. So talking about why, a lot of the work that we do is very intellectual. So we will go in with programs, or I'll go into with something, this is what we need to do, this is how we need to do it, bam, 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 bam. And I probably miss out, because I'm rushing, because of the environment that we're in is very, very pacey. I miss out this connection, or I used to miss out this connection. Then I got hooked on Simon Sinek. He's got loads of TED Talks. I would invite you to watch them. And he talks all about the why. He says, start with the why. and that's connecting with the heart. Emotions move people to action, so that connection with the heart is why we're doing this. What is our cause? What is the purpose? And it's not to reach the target. The purpose, keep going down to that why. The purpose is, it might be, well, it could be better quality of care, patients receiving the care at the right time with the right quality, optimal things. So think about the messaging that you're working with people when they are committed. When you connect with the why, they are far more committed to the cause and continuing it over a long period of time than if you just go in with the how are we going to do this and what needs to be done. Now, Mark Jabin is one of my favourites. So Mark Jabin is a physician in America, and he talks about the science behind resistance to change. Now, resistance to change, we all have it. I've had loads of it, and I'm sure you'll have had experience of having loads of it too. He says this is what you don't do. You don't have an issue, a desired outcome, options, and then a choice, and engage people at the bottom. We do this, but you shouldn't do this. He says engage people lots higher up. So the issue, get them in at that desired outcome and that shared space. Now, I haven't devoted my life's work to resistance to change, but I've had a lot of it and I've learned loads. And I would even disagree with Mark here, even though I love him. I'd say invite people right at the top to be involved when we're at that issue point, and then people will be with you. And this beautiful quote at the bottom, instead of buyers who buy in, we need investors, and we need investors for sustainability of the work that we do. So have a little think about that. Where are we inviting people to do? Again, in the past, you know, I've done the left-hand side and I've like, ta-da, I have to work this out for you. But ta-das don't work. We need to take people with us. And this is just beautiful. This makes me smile all the time. The IKEA effect. People love it more if they made it themselves. So let's help people make things themselves. So as I come to close, I've just got one final model for you. This is the model for large-scale change, and it would have been amiss to go without this in here, but it can be used for small-scale changes as well. You start at the top left, you identify the need for change, you move down into the model, and this is where you think about framing, reframing your issues, connecting with the heart, connecting with the, you know, the why and what needs to be done. Engage people in what you do, make some pragmatic changes, engage them more. So maybe moving out of that silo into those networks that you've got across systems, reframe your issues because you will have learned something more, engage some more people, do something, reframe because the world's changed again, and keep going round and round and round in this loop. This loop could take a week, or it could take a month, or it could take more or less. And you go round and round and round and round, building people, connections, and this is how we get to sustaining the work and then going back round again. So to conclude, everything won't go right at first, and that's okay. Learning, failure is learning, like you've seen from myself today. I've given you a little bit of theory, but theory is not enough. But remember that model for large-scale change. It's all about people and relationships, who you're involving, building your networks, understanding that everyone has that different starting place and we need to adapt ourselves, and involve to reduce resistance. Those are the reflections. So I do hope that you've managed to find a few things out of there that you can use in your programs to think about what you could do in your work, and there's some more links there as well. So that's my presentation. We haven't got time for questions, but if you've got anything that you want to ask, please don't hesitate to contact me or pop it in the chat and I'll answer them as we go on.
Brilliant, thanks Zoe, that's great. So yeah, pop those questions in. and we'll start popping some responses in for you. So back to yourself, Zoe.
Thanks, Victoria, Vicky. So we've got a exciting moment that I hope you have been waiting for. So we've got these Clinical Audit Heroes Awards, and this one was really focused on sustainability. So hope you're ready for the results. So we have 2 that came highly commended. So these are our 2 highly commended. So congratulations. We've got Dr. Simon So on behalf of the dermatology team at South Warwickshire University. And the judges were super impressed with the facts that this project looked at sustainability from multiple angles. The context was well set, and they had clear objectives, a clear design, and a clear focus to their work. So congratulations, Simon and your team at South Warwickshire University. And the second here is Adam Jones and Hiba Aldawani. Congratulations. They're from the University of Leeds and Leeds Teaching Hospitals. And the judges commended this excellent presentation for identifying a need, then designing a clear project to address that need. So congratulations, all of you and your teams, on the fantastic work that you're doing. So we're ready for the winners, and the winner is, here we are, Zara Shahabi and your team at Barts Health NHS Trust in paediatric dentistry. So fabulous, congratulations, well done. And this was a truly descriptive, extensive project with multiple outputs that were extremely well summarised. There was sound evidence base and clear methodology setting out the journey from collecting the data all the way through to making improvements. So congratulations.
Lovely, thank you, Zoe. So I think at this point then we're going to pop up the slide pack then, if we can, Marina, and we're actually gonna hand over to the paediatric team to present their winning project. So over to yourself.
Thank you. It's an absolute honour to be able to present this collective bit of work, which is very much led, as you mentioned, by our consultant, Dr. Zara Shahabi, who unfortunately can't be with us today, but she's certainly one of those pioneers that you spoke about, Zoe, and really get stuck in and get things happening. So on to the next slide. So this project, as I mentioned, really overlooks sustainability. The reason that we chose this as a target is because we know that the impacts of climate change on human health are really multifaceted. So this diagram just really presents some of the ways that climate change can negatively impact human health, which is obviously all why we're working within the NHS. So, for example, we've noticed increase in times of heat waves, which negatively impacts things such as cardiovascular and respiratory diseases. So this is why we wanted to kind of select this as a target. So next slide. So whilst we aim to promote and protect human health, the NHS is unfortunately within itself one of the contributing factors to climate change and carbon emissions, and accounts for about 5% of the UK's carbon emissions when we look at healthcare as a whole. And as healthcare workers, we're really in a privileged position in terms of how we're viewed by kind of wider society. And we're able to use our voices really to advocate for change and be those kind of pioneers in terms of reducing climate change. So we wanted to look at how we could really impact this within the trust itself. So on to the next slide. So one of the first things that we did is we really took a step back and had a look at our patient pathway to see where these kind of carbon hotspots are and what we could target in terms of reducing that impact. So we noticed high impacts from kind of staff travel to the hospital, as well as kind of patient travel. So Bart's being quite a specialist unit, we have some patients that travel really quite far distances to come reach us and might need to attend multiple appointments. Things such as procurement of instruments and also kind of sterilisation. So these all really offered kind of targets that we could use in terms of our quality improvement to try and reduce some of those impacts. So next slide. So whenever we go about kind of designing any sustainability quality improvement, these are kind of the 4 areas that we really look at to target. So something that we're really passionate about is patient empowerment and kind of self-care. We know that if people don't need dental treatment, then we can really reduce that need for kind of high carbon emissions through kind of treatment. A lot of our dental treatment that we do is unfortunately preventable and then linked to kind of the wider social determinants of health. So anything that we can do to kind of prevent that need is vital to kind of what we're doing. We also really look at kind of lean service delivery as well as kind of low carbon alternatives, which we'll speak about a bit more in a minute. So on to the next slide. So this is really where we developed EnviroDent, which encompasses, as you mentioned, a really multifaceted approach to quality improvement around sustainability. So some of the key outcomes that we really look at is we want to see kind of positive outcomes in terms of patients, environmental, our financial benefits as well, and also that social aspect. So whenever we're designing and also auditing our kind of quality improvement process, we try and look at all of those across the whole spectrum so that we're really getting an in-depth kind of analysis of that process and seeing kind of what those benefits are. And we're going to touch upon a few of these projects as examples today. So on to the next slide. So I mentioned a little bit about prevention. So one of the programs of work that we've been doing is working with our student group. So they're called Bart's Community Smiles and they're led by a dental public health team. And they go out really into the communities and speak to people that might not be accessing care to offer kind of preventative advice in terms of good oral hygiene. They also speak about things like tobacco cessation and kind of diet control. And that's really something that we're very passionate about, is engaging our students within our quality improvement process as well. We also work very closely with our psychology team who conduct a lot of their kind of consultations virtually to try and reduce the amount of patients that are dental phobic and try and support them in receiving care as well, so that we can reduce our need for things such as nitrous oxide, which we know can really damage and harm the environment. So next slide. So one of the things that we really noticed is when we were looking at a lot of other different sustainability kind of quality improvement programs and examples of what had been done in trusts, something that we felt was really lacking is that patient involvement. So what is the patient perspective on sustainability and environmentally friendly kind of dental care? So we just did a very simple survey where we were asking patients about their awareness of sustainability, both in terms of their lifestyle and also their dental care. And what we interestingly noticed is that actually we could use sustainability as a motivational tool to help patients kind of motivate themselves to look after their mouth, I think, if they were a bit more aware about the environmental impact of the treatment that we were delivering. On to the next slide. So just to address this treatment need, there's a really great tool from the Royal College of Anaesthetists that just speaks about the environmental impacts of anaesthetics. So we use that as kind of a blueprint to then create a patient information leaflet on kind of dental treatment and the environment. And that's been really well received by our patients and something that we're very proud of as a trust. So I'm just going to pass over now to Julia, my colleague, who's just going to speak about a few of our other aspects of the project.
Thank you, Joelle. Happy to move on to the next slide. So on the topic of leaning down service delivery, we've been looking at ways to engage multidisciplinary teams during appointments so that a patient can attend for just one appointment but be seen by multiple teams. We're also moving towards virtual appointments, including consultations prior to attending the dental department, and that's to ensure that each face-to-face appointment can be the most productive. And so far, around 70% of our patients have actually required additional input from their GP, and we're currently in the process of quantifying this. And of course, we're aiming to minimise waste by reducing our plastics and segregating waste into appropriate bins. We've recently introduced a TerraCycling recycling box for toothbrushes and toothpaste tubes, which is being regularly used by patients and staff. Next slide, please. Thank you. We're also moving on to bigger things, including reconfiguring dental instrument trays, and we're trying to redesign these to combine commonly used instruments and reduce the sterilisation cycles and processing. We're aiming to use reusable alternatives to disposable instruments and to use clean instrument wraps. To reuse the clean instrument wraps rather than binning them. And these changes are bringing both financial and environmental savings. Next slide. An ongoing trainee-led programme in leaning down service delivery is using the optimisation of nitrous oxide, also known as laughing gas. And these graphs show that there is a downward trend in our use of nitrous oxide, which could be as a result of multiple different things. This could include switching off cylinders when they're not in use, providing education to clinicians to make sure they're giving enough time between titration doses and to observe the effectiveness of the nitrous oxide, and also ensuring that clinicians are not keeping patients on the maximum dose of nitrous oxide for the entire treatment session unless it's necessary. And the procedures have resulted in good patient outcomes, and nitrous oxide in general helps us to prevent sending a child for a general anaesthetic, which, as I'm sure many on the call are aware, is extremely resource intensive, including its use on energy and staff. Next slide, please. So as a result of a staff questionnaire, we've managed to get some reusable theatre caps for the staff in the dental general anaesthetic suite, and these we met with really good engagement, as you can see in the pictures. The caps are providing multiple benefits, including environmental, but also as a really effective communication tool, and we're excited to be expanding those into other dental general anaesthetic suites. Next slide. So as part of a larger project, we're working as a multidisciplinary junior group to ensure that staff are using the right level of PPE for the right procedures. And this is really a by change, as Zoe mentioned, a change that's done by us, for us. And as feedback from the infection prevention control team, we created this patient-friendly poster to ensure that patients as key stakeholders are aware of the changes that are being made and the benefits that we're having on the carbon footprint. Next slide. So on the same kind of theme as the previous slide, this is the staff-facing poster, which helps our staff to be mindful of the PPE and drape choices they're making and ensuring that they understand the different impact on carbon footprint and the cost of sterile versus non-sterile PPE. Next slide. Alongside the dental school, we are improving our digitalisation of services and providing virtual consultation. One aspect that I use most weeks is the digital intraoral scanner, which is much better accepted by the patients that I see and prevents the need for repeat impressions and their transportation to the lab. Next slide. At every step of the way, we've really aimed to engage key stakeholders such as our staff and the undergraduate dental students, as you can see in the pictures. These really are the clinicians of the future and will be instrumental in ensuring long-term sustainable changes, thus future-proofing any impact that we're having. We've engaged undergraduate dental students in various sustainability-based workshops, including a pitching workshop named Dragons Dental, which received really good feedback. Next slide, please. So as you've heard from the other speakers, there are lots of things we can do, but one of the most powerful things that we have is our voice to advocate for change and empower patients, staff and students to make these changes too. If you are interested to see a bit more about our student engagement projects, the Barts Dental Student Rap Society, the Dental Drillers, have created a climate clash rap, which is accessible on YouTube and is helping us to promote making a greener choice. Next slide, please. So thank you all so much for your time, and thank you again to the NQI CAN for the Clinical Audit Hero Award. If you do want any more information, Dr. Shahabi is very happy to share her email and you can contact her directly. And I think we might have a little bit of time for questions. Thank you again.
Oh, thank you. That was amazing. And yeah, that's really made me smile at the end with the dental drillers. And
they're really good. They're really passionate as well.
It's good, isn't it? Really good. And obviously you've touched on quite a few key points that you've talked about, Zoe, as well, which was, it was amazing, wasn't it? It was as if you spoke to each other before you both presented. That was fantastic. So have we got any questions? Do you want to raise your hands? I'll have a look and see. Not sure if we've got any questions in the chat, Marina, if you can see any in there. Oh, Kim, there you go, Kim. Do you want to take yourself off mute?
Yeah, can you hear me? Hi, Vicky. And hi, thank you so much. It was such a good presentation. I really enjoyed hearing about that dentistry one. You talked about involving patients, which is, I imagine, sort of, it's quite an interesting area to involve patients because they come in and go out. They're not kind of long-term in your care. So I just wondered how it worked, how you did it, you know, what the process was.
I'll hand to Joelle for that because that was her excellent project.
Yeah, so with dentistry, I would say we do have patients that move in and out. The area of dentistry that I was working at Barts is special care and sedation. So actually, we see patients for years and years because they're usually patients and their carers who are unable to kind of accept dentistry anywhere else. So that kind of gives quite a unique opportunity to kind of discuss things kind of longer term. But we did also roll it out with kind of restorative patients who are a bit more fluid and kind of in and out of the system as well. And I appreciate that. I think something like a patient survey is very sensitive to kind of things like current affairs, kind of political views, etc. So it's definitely something that we probably need to re-establish and keep kind of redoing. And as I think Zoe mentioned in her presentation, is that change is something that is very fluid within the NHS, and we're also part of a much wider system as well. So things like the patient leaflet might need updating, and we definitely need to pilot that with kind of certain subpopulations as well within our patient group. So they're all definitely things that we want to work on. But I think the project really was more just to establish how can we get patients actually involved in sustainability work, because it's not something that we'd seen a lot of, especially within dentistry. So it really just set kind of a footprint of where are we at the moment, and is this even something that patients want to engage with? So it's really positive to see that they were very passionate about it as well. And then how can we align those kind of goals between ourselves as clinicians and also patients in terms of that wider care for the planet?
Brilliant, thank you.
You've got a question in the chat from Richard Stubbs.
Lovely. Yeah, yeah, Julia, they're just asking, have you looked at options for sourcing remanufactured medical devices that offer much smaller and sustainable waste management and production cycles?
Oh, I will definitely pass that back to Dr. Shahabi. She's kind of spearheading those kind of wider configuration changes. But as you can see, the project has so many different arms. It's completely multifaceted, and we're really keen to kind of keep building on it and engaging more trainees and junior members of the team to kind of spearhead and focus on these different areas. So I'll definitely pass that on to Dr. Shahabi. Thank you. That's very helpful.
Lovely, thank you. I think Jordan, he's our North East Regional Network Chair, he's just popped in the chat for you about any words of wisdom really for how we could spread the message and encourage other dental teams to look at this, and also if you looked at publishing your work and producing a case study.
Yeah, thank you. It's really lovely comment from Jordan. We are keen to kind of work with other dental teams at our site and at different sites. I think a great way to do that is by kind of publishing the work that we're doing and presenting it in forums such as this. So Dr. Shahabi is currently giving another presentation on this work at another trust in London. So that's another way that we're trying to encourage others to get involved, sharing what we do, and also by giving them some relatively kind of straightforward and easy wins in a way in terms of the sustainability changes, because I think that can really help to boost morale and encourage us to take part in the quality improvement projects. But we are definitely looking to kind of put together a write-up of the work that we're doing and publish it, although it might be a part one, because hopefully there'll be multiple parts as we continue the project.
I'm just going to put you on put you on your feet then and just pick up on what you said there, Julia. Easy wins then. What would you say might be a few top tips for easy wins then, but bearing in mind what Zoe shared with us and that making sure it sustains?
Yeah, well, I think something that was maybe easy is a strong word, but I definitely think that having the workshops with the undergraduates was quite like a maybe quicker win. We didn't need to go through infection control boards, for example, to get acceptance for that. We could host the day. It's really encouraging. It's something a little bit different for the curriculum for the undergraduate students. And a lot of them have really fresh and new ideas that we maybe can't think of from having worked in the NHS for a number of years. It's always good to get kind of new colleagues into the trust and undergraduate students involved. So that was a really rewarding session. I really would recommend doing that if you can.
Yeah, no, I think that's brilliant. And you made that valid point in your presentation as well, didn't you? That this is our workforce for the future. So actually it's
100%.
changing those hearts and minds at that point in their career, isn't it? And they obviously will be our future leaders as well. So yeah, really, really important. Lovely. So are we seeing any more questions? Are we seeing any more hands? Has anybody got a burning desire? If you don't want to put your hand up, pop your question into the chat, or if you've got any questions for Zoe as well. Otherwise, I might get you to put the survey link in.
A question from
Marina.
Zoe.
Oh, lovely. There you go.
It was just I'd just noticed Abigail in the chat had said submitting a poster or oral presentation to IHI BMJ conference. So I think the deadline for that is it's not long away. So I'll see if I can find the link for you and pop it in the chat. And I'd encourage you, like, what a fantastic presentation. There's so many beautiful elements in there about engaging people, and the questions that you've had about, you know, how can we start thinking about spreading this as well and spreading the good practice. So it's not just everyone in your locality that gets this fabulous service and all these savings as well. It's other people across the country. So I'd really think about, you know, how can you use the network, the forum that Vicky mentioned at the beginning of the session, spreading what you're doing. And this is for you and this programme, but everybody else on this call as well. What is it that you're doing that can help other people, and how can we help each other through this? And I would suggest that everyone who's got a project put something in for this IHI BMJ conference, and keep sharing it. Put it on the forum, this new forum that Vicky mentioned at the beginning, and then we can all learn from one another.
Brilliant. Thanks, Zoe. That's it. Yeah. Pinch with pride. That's what we keep saying, don't we? Pinch with pride. There's no point in reinventing the wheel. It is sharing, isn't it? And we can all bring each other along on this journey together. So yeah, lovely. Marina's popped a link into the chat for a survey. Thank you, Lacey. I can see Lacey has also put the link to the HQIP Cornerstone Quality Improvement Magazine. This was the 2024 one. There's a whole suite of fantastic articles in there. I know we put one in for sustainability in terms of clinical audit in for the long haul. But there's some really good articles in there that will inspire you. You can access that via the HQIP website. So yeah, brilliant. You've got some lovely comments in the chat. So I hope you've got time to go up and down and have a good read. Please do click on the link and give us your thoughts on the survey as well. That'd be brilliant. But if we move to the next slide, I think it's just really looking at everything that we've touched on this week. And we always put sustainability as the last day, because all the topics that we touch on in Monday, Tuesday, Wednesday, Thursday lead right nicely into thinking about future proofing at the end of the week. But through future proofing, it does mean about taking forward those first 4 topics. And obviously on Monday we looked at patient safety and how we can effectively utilise clinical audit to try to prevent that avoidable harm. And there were some really, really good key messages in that lunch and learn for us to take back to our own organisations and to consider. And it led so nicely into patient and public involvement in Tuesday, in terms of us making sure that we are involving people that are accessing our health and care services every day in the way that we are looking to improve it. And for me, that's about reshaping. It really is about reshaping health and care. And obviously we talked about that today in terms of making it fit, making it a health and care service that's evolving with us and moving based upon demand and need. So on Wednesday, we looked at health inequalities. And again, this is about making sure that we are looking at the equity, we're looking at the access, and we are again reshaping health and care to meet the needs of everybody, but particularly those marginalised groups. And then obviously shifted that focus on Thursday and Friday onto, well, actually, if we're looking at everything in the right way and we're reviewing that data in the right way and in context to tell us what we need to improve on and where we need to improve on it, it's really getting underneath it and understanding then how we do that and who we make those changes with, and touching on some of the things Zoe shared with us today alongside what Sam shared with us yesterday around data in context, and then really bringing along the people with you. Hopefully throughout all the 5 days we've really taken away some really valuable key messages that we can take back to our own organisation. So there was lots in there. We are sharing all the slide packs because I know you touched on so many different models there, Zoe, within your talk with us, that I know we're all going to be going away and looking those up, and so valuable. And if you think about the 4 stages of audit, for years we've just been pushing, haven't we, about that whole project planning stage being so important to get right, so that then the other stages of the project kind of seamlessly happen. And identifying that issue with the people that we're working with, that are on the ground working, but also the people that are using the health and care services, then you'd hope that we are working together to identify what needs to change and how we change it. So you'd hope you'd get to the point where it's sustained and we've reshaped health and care based upon need and demand. But one of the biggest things I think this week, and it's been fantastic seeing everybody join us every day, is the fact that we're all keeping this conversation going together, and we're learning, we're sharing, we're networking together, and we just need to make more of these projects more visible so that we can pick them up, take them back and apply them to the context of our own organisation systems and pathways. So for me, I just think it's been a fantastic week. We've had some fantastic days, fantastic speakers, and today just feels like it's been absolutely brilliant again, doesn't it? We've had, Zoe, you've shared a wealth of information with us to inspire us, and obviously Bart, you've just shared a fantastic project with us that you just think, wow, do you just want to pick that up now, don't you, and take it away to our own local audiences? So thank you so much for everything that you've contributed to throughout the week and obviously today as well. But I'm going to hand over to Lacey, who's head of comms at HQIP, and she's literally going to share a lot more resources with you as well. So Lacey, would you like to unmute and take the floor?
Hello everyone, I hope you've enjoyed today, enjoyed the week. I'm not going to take any more of your time than a few moments. Hopefully I won't sort of ruin the day by blabbing on about corporate stuff. It's been a wonderful, wonderful day, but it's been a wonderful week. So thank you to everyone. Thank you to NQI CAN. Thank you to all our speakers, the event participants, and everyone behind the scenes, including the judges, etc. There's so many people involved in these events. To the award winners, of course, today's award winners, but everyone for taking part in the awards and submitting an entry. And of course to patients and carers for supporting this work, some of whom we've seen in these events this week, which has been so invaluable. And to everyone up and down the country for sharing and arranging events and activities. We've seen so much stuff going on social media, so it's been absolutely wonderful. And if I've forgotten anyone, this is turning into a bit of a award speech, I'm afraid, and I haven't even won anything. Please forgive me if I've forgotten anyone, but so all those thanks. I just take a quick moment to mention that there's a whole host of resources, reports and other outputs that you can find on National Clinical Audit on the HQIP website. This is the corporate bit, I'm afraid. Don't forget that we also offer quality improvement services, so please do look us up for that. And I think I posted our sort of free publication, magazine-like publication, which is there to support quality improvement. It's just hquip.org.uk/magazine. It's free. It's got an article by the very wonderful Vicky Patel, so please do go and take a look. Finally, all things Clinical Audit Awareness Week or event recordings can be found on our website. And so just go on there, this week and next week and keep this whole thing going. It would be wonderful. I want to finish with one final thought, which is we all have lived experience of being patients, sadly. I do too. So in some ways this week has really underlined for me the role that you play in transforming and changing patients' lives. So it's been so powerful. Thank you. And I'll hand back to Vicky.
Oh, thank you. And it's we've had a couple of patient and public representatives that sit on the Sun members group with Kim at HQIP that have personally sent emails this week as well, and I think it's been lovely to hear their feedback and how they've fed back. They're so inspired by what they've heard this week from the health and care community and everything that we're doing through clinical audit to improve things. And you just think that's so lovely to read, isn't it? And when you get that email, that you just think that the fact that they recognise it and they're thanking us for everything that we are trying to achieve. So yeah, thank you. And obviously, Lacey, you've just popped in the chat that we've got that lovely conversation later with Stella Big, National Medical Director, and Claudia, the Clinical Fellow at HQIP. So that's set to be a good event as well, talking all things clinical audit. So yeah, please do go along to HQIP's website and register for that if you're not registered for it already. So just a massive thank you. Marina, did you want to say anything, obviously, as we're closing the week?
Yeah, just again, thank you to everybody who's joined us this week. I think it's been absolutely fantastic, and yeah, just really want to encourage everybody to get on the new platform. I've been frantically trying to approve all the membership requests as we've been going along this week, but there are obviously loads of requests that we've sent out to the previous members, so please do get on and just start the conversations. There's lots of different areas of the forum, loads of different functions on there, different things that you can do, so loads more flexibility for what we can do, and we're really going to be sort of using that as our main way of communicating with you as a community. So do get on there and use that power of people that Zoe was talking about.
Yeah, brilliant. Thank you. So really big thank you then. Thank you for our attendees that have attended. Thank you throughout week, but specifically today, obviously, thanks to our paediatric dentistry team at Barts, and obviously thank you so much, Zoe, for your session with us as well. So thank you. Enjoy the rest of your afternoon and watch this space for the follow-on from Clinical Audit Awareness Week in terms of what we do now as we carry on through year. So thank you very much. It was lovely to see you all. Take care and we'll catch up with you soon. Thank you.
Thank you.